Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's learn ICD chapters 2 to 4. Okay, this consists of Neoplasms, which is a very important chapter, Anemia, Endocrine and Metabolic Disorders. So let's have a look into it one by one. So first we will learn about Neoplasms, means cancer. Okay. And the ICD code ranges from C00 to D49. Always check and confirm in neoplasm index if the neoplasm is benign in situ, malignant or of uncertain behavior. So you should always check in there is neoplasm index also, table of neoplasms, neoplasm index. It is there in the beginning of the ICD book. So in that you should always check if the neoplasm is benign, malignant, in situ or uncertain behavior. Use primary malignant, secondary malignant, benign, in situ or uncertain behavior. Yeah, you should use either if it is malignant, primary malignant or secondary malignant according to the documentation given. If any complication occurs because of cancer, code first for the complication. Okay, because of cancer, if there is any complication, you should not code cancer first, you should code always the complication followed by cancer code. If there is any pain due to cancer and the reason for encounter is to treat the pain, code pain first, followed by C code. Same like that, if there is any pain due to cancer and the reason for the encounter is to treat the pain, not to treat the cancer, okay, just to treat the pain. So in that case, you should first code pain code and then followed by the C code, means cancer code. Now, cancer patient went for chemotherapy. First code for therapy and then code for the cancer. If there is a chemotherapy, you should, if patient has went for chemotherapy, you should first code for chemotherapy and then code for the cancer. If patient is there to remove breast cancer after which a chemotherapy is scheduled, first code for cancer, then chemotherapy. Okay, because the patient had the encounter for the reason for encounter of patient is to remove the breast cancer, right? And after removing the breast cancer, chemotherapy is scheduled. So first code for cancer and then chemotherapy. So these are the codes for therapies. Encounter for chemotherapy is at 51.11. Then for immunotherapy is at 51.12. And encounter for radiation therapy is at 51.0. That's just for your knowledge. Brachytherapy. Brachytherapy, if the patient has come for brachytherapy, code for cancer only, as there is no code for brachytherapy. Okay, we should code only cancer code if the patient has come for brachytherapy. If there is a secondary lung cancer with primary unknown site, code will be C78.0, C80.1. Yeah, it means if there is a secondary lung cancer with primary unknown site. So the site is unknown. We don't know which part the cancer belongs to, the secondary lung cancer belongs to. But the primary means it's a secondary lung cancer, but the primary site is unknown. Means primary organ, somewhere it has, the cancer was there and it has been spreaded to the lungs. So the primary site is unknown. In that case, you should code C78.0, the unknown site, and then the lung cancer. Okay. Now, anemia, cancer and therapy. If anemia due to cancer, first code for cancer. If the patient is having anemia because of cancer, you should code for cancer first. But if patient is having anemia due to therapy, chemotherapy, okay, first code for anemia, then followed by cancer, then code for the adverse effect if there is any adverse effect. Okay. If the patient doesn't have the disease currently, code it with a history code. All Z codes, Z codes, Z codes are history codes. So if patient doesn't have any symptoms or any disease currently, but there was a history, so you should code it with the C codes, not C, Z, okay, Z codes. For example, patient had a breast cancer a year ago. and is now diagnosed with a duodenum cancer. So a year ago, patient was having breast cancer. She is totally symptoms free of breast cancer and is undergoing no treatment currently for the same. In this case, first code for duodenum cancer, then followed by history of breast cancer. Currently, she is having only duodenum cancer, but there was a history. So you should code like that. Code first for the duodenum cancer and then followed by the Z code, history of breast cancer. Now, what's overlapping lesion? Cancer in one part spreading to another part. That is called overlapping lesion. For example, first cancer in the upper lip, then spreading to lower lip. It is called overlapping or continuous or contiguous. These are the terms for overlapping lesion. Okay. Now, existing versus new. Example, patient is being treated for breast cancer and now she is having liver cancer. Code first for breast cancer followed by liver cancer. It means patient is being treated for breast cancer, means the treatment of the breast cancer is still going on. And then along with that, she is currently having liver cancer. So in that case, first code for the breast cancer followed by liver cancer. Now E codes. What are E codes? It represents endocrine and metabolic disorders. E10, E10, E11, E08, all these are diabetic codes. Okay. E10, type 1 DM or juvenile. Juvenile means from childbirth. E11 is type 2 DM. The default diabetic code will be type 2 DM. Okay, E11. Type 2 DM is the default one. E10 is type 1 DM, juvenile DM. Now, E08, DM due to underlying condition. First code for the condition, then DM. E08 means DM due to underlying condition. It means the diabetes due to some condition. So, first always first code for that condition followed by the diabetic code. Okay. Code for long-term use of insulin is at 79.4. Long-term use of insulin. Okay. And code for long-term use of drugs or medicines, the code is at 79.84. This you will get in few questions. If the patient is under both insulin and drugs, code only for insulin. If the patient is under both insulin and then drugs, medication for the diabetes, then we will code only insulin. Now, insulin pump malfunction. Insulin underdosing code, insulin overdosing code. These are the codes that you don't have to remember, but you should, like if you are getting some question like insulin overdosing, immediately it should come in mind that it is starting with T. Okay. Insulin underdosing code T38.3x6. Overdosing code T38.3x1. So there is one example for underdosing and overdosing. So underdosing means this example I have given with 3 different codes. This is the order of how to use codes during an insulin pump malfunction. Okay. First you should code, if it is underdosing, first you should code T85.614A. It means breakdown of insulin pump initial encounter. See down I have mentioned what is that, what does that code represents. Okay. So T85.614A represents breaking of insulin pump initial encounter followed by underdosing code T38.3x6 and then the DM code 11.10, type 2 diabetes with a ketoacidosis without coma. Now that diabetes code will change according to the documentation. This is just an example. Okay. Now what about overdosing? First you should code T85.614A, same breakdown of insulin pump, because this is insulin pump malfunction. So that malfunction should come as the primary code. Okay. So if it is overdosing, first you should code breakdown of insulin pump initial encounter and then followed by poisoning. If it is overdosing, it means it will be poisoning, right? So poisoning code T38.3x1. Insulin overdosing code. Insulin overdosing code, that means it's a poisoning code. Poisoning by insulin and oral hypoglycemic drugs. Underdosing means underdosing of insulin and oral hypoglycemic drugs. This is overdosing, so it means poisoning. And then followed by the DM code 11.10, sorry 11, type 2 DM, whatever is there in the documentation. So for insulin pump malfunction, you should always first code for the malfunction code, followed by if it is overdosing or underdosing, and then followed by the DM code. Okay, so this is just an example to understand. Now, index table of drugs and chemicals. There, if you take the ICD book, you can see in the beginning index page of neoplasm, same like neoplasm, you will be seeing after that index table of drugs and chemicals. You can easily get the codes from there. Poisoning, unintentional. These are the columns mentioned there. Okay, poisoning, unintentional, which will come as a default poisoning code. Poisoning intentional means self-harm, suicide, like that. Poisoning assault means someone is trying to harm you. Poisoning undetermined means not sure if it is intentional or unintentional. Then adverse effect and then underdosing. So these are the columns mentioned in the index table of drugs and chemicals. You can just go through it, and for the documentation you will get the code from there itself if it is something related to poisoning of drugs and poisoning. Okay, along with drugs and chemicals. So friends, that's all about neoplasms, anemia, endocrine, metabolic disorders. Chapters 2 to 4 describes all these conditions. So when we will begin with the questions, you will be knowing more about it, how, like more guidelines you will be getting how to code it and everything. Okay. So if you have any comments, you can mark it in the comments for any inquiries. And thank you so much, and we'll see you in the next episode with the new chapters. Okay. Bye. Take care.